Hello there, Wednesday evening, and we are going live to chat and talk about what we're doing here at Reactive, and in particular tonight. I'm super excited because Katherine is joining us, and I see that she just joined. We're gonna bring her on here, and here we go. So awesome. Let's get her on and
Hello.
yay! I'm always so excited when this works, Katherine.
I was worried, like, oh, how's my connection? Never
I
know.
I know you never know, and I mean not that it's snowing today, but I know we've talked before, and it's like you're in Colorado, and boom, there'll be like a snowstorm out of nowhere.
Right. Never know what we're going to get. Keeps us on our toes.
Yes. Yeah. So, Katherine, by the way, thank you. Thanks for being a part
No.
of this and joining us live.
Thank you
And
for having me. I'm so excited to be doing this with you.
yeah, me too. I feel like first of all, like as I was thinking about this and as we were going to chat, I was like, I can't believe I haven't known you for a very long time because it just feels like we just have a lot in common. We're doing a lot of the same things,
Yes.
and maybe because we hang out every month that it feels like we're old friends. And so I'm
I
just
agree.
very thankful for that. Um, and so this week, as we're preparing to open our Brain Bites doors, I wanted people to get a chance to meet other people that are a part of our community. I'm on here like every Wednesday, and I'm on our Facebook every Friday, so people kind of know who I am, but maybe not other people like yourself. So
Yes.
I wanted people to meet you and really even just start by hearing who you are as a PT, as a person. So can you tell us a little bit
Yeah,
about you?
absolutely. So, my PT interest began mostly, like most of us, had to have PT ourselves at some point, right? So I was a competitive gymnast who, like, wrecked my body all sorts of different ways by the time I was 13. Um, so that began my interest in physical therapy, and I graduated from the University of Puget Sound in 2001. My first job was in California at the Community Hospital of Monterey Peninsula, affectionately known as CHOMP. Um,
Yeah.
so that was just a great like introduction to all things PT, getting to be in an outpatient setting but connected to the hospital. I found myself like 2 months into my career, they're like raising my hand in a staff meeting that I would be the therapist to learn vestibular content from the PT vestibular guru who was going out on maternity leave. So I got to learn from her like one on one, and then went through the Herdman competency course in 2002. Um, and the neat thing about being in that hospital setting was I could see patients in the ER. So they'd had their CT scan and had EKG, all the big bad stuff's rolled out. And then I'd get to see them like with their ocular tilt and the resting nystagmus that we typically see in an outpatient setting, like you see in a video on YouTube or a little diagram. So that was so educational for me to see a person like right from the get-go and then get to be part of their rehab journey through the end. I just learned so much in those early years. So I was really grateful to have that experience. Um, and then in 2004, my husband, Eric, who's also PT, we met in PT school, we moved back to Colorado, his home state, and I began working at an outpatient neurovestibular clinic and met Jamie Wahab, my awesome teaching partner and neuro bestie. Um, and so we just became like quick friends and very parallel lives, the three of us.
I know.
um, and so we studied for our NCS together, and like, thank goodness I had a partner, because this is well before the days of courses to help you study. So we would be in the library, like photocopying articles from
Gosh,
dusty
me
bound
too.
journals, right? Sound familiar? Yes. I'm like, you newbies have to go through this.
I know.
So that was just so fun because Jamie and I spent a lot of time studying together, and just, it was nice to have that support. Um, and then in like 2010, Eric and I started our own practice together, just kind of ready to be our own bosses. And it was really born out of this idea that whenever we'd have like a snowstorm, I'd have no patience for the day because they weren't comfortable just navigating through the parking lot in a wheelchair or walker, or those who are really dizzy have a hard time with like snow blowing at them and dealing with a windshield wiper. So my whole day would just fall apart. And we started to think, well, what if we went to them? I'm comfortable driving in the snow. And so that was the beginning of our practice. And here we are 11 years later with 6 therapists now. We hired 2 neurovestibular PTs in the last 6 months. So I'm no longer the token neurovestib PT, and one of them is Claire Cronenwith, who is a Re+active fellow. Julie completely brokered that deal for us, so we're so grateful to Julie for hooking us up with Claire. She's just an awesome addition, so super grateful for that. And that's kind of like where I've gotten to today. But how I got to know Julie, because I do feel like we've just known each other forever. I was so fortunate to get to hear you speak at CSM when it was here in Denver in 2020, like weeks before the whole world shut down.
Yeah.
And the neat thing is, you know, the longer we are in our careers, the harder it is to find like really good neuro courses. Right? There's a lot of overview, but there's not a lot of that deep dive, like specific, like that we're really looking for. And it's not often that you come across a talk or a course that's a real game changer, but your talk with Chelsea on functional movement disorders was like amazing and a total game changer for me. So thank you. Not only learning more of like assessment and treatment of functional movement disorders, but also getting introduced to the optimal theory, which I can apply to everybody, and completely different from what we would have learned in school, right? Where you would be very internally focused. And so I use Optimal all the time now. And because the pandemic then happened shortly after, Jamie and I were like, hey, we've got all this time. Let's actually read that not so short article.
Oh my gosh. It's so thick. It's so thick.
But amazing, amazing. So that was my first introduction to Julie. And then when the pandemic happened and we sort of all had this time on our hands, like, what are we doing and how do we keep a practice going? You had a seminar on telehealth in a week. You probably don't, you've had so many educational things that you've done in the last like 14 months. But that was so helpful. It was a jumpstart we needed to get our practice going because it was clear, like, this isn't just 2 or 3 weeks. We're going to be in this for the long haul, and we need to continue to serve our patients. How do we do that? And especially, a lot of other courses out there are very ortho-focused, but how do we do this in a neuro population or people who are a fall risk? Like, is this even safe? How do we do it? And now it seems like, why hadn't we been doing this all along?
I know, right?
But that was just another opportunity for me to learn from you. And it was, again, amazing. You know, dense content, but in a fun delivery. So it was such a great start for us to get going on telehealth. And then Brain Bites was introduced, and I wanted so badly to start from the get-go, but our practice wasn't seeing the same volume of patients we would normally, and I just spent all this money on CSM, so I sadly passed on the very beginning of Brain Bites, but Jamie started. And so I got to hear all the amazing things that she was learning in Brain Bites, and the discussions you were having, and the articles, and just treatment ideas. So I was super jealous, but I still got to like glean from her what you guys were doing. And then she was like, you really have to, there's going to be this mini course on camptocormia. You need to do it. And so I did and loved it because I learned a ton from you and Brittany, just different assessments and treatment strategies. But also, it was just such a fun way to learn and to feel like how I'm getting to connect with people when we just were feeling so isolated. So that was just another like reinforcer of, okay, when Brain Bites opens up, I definitely need to make this happen. So then October 2020 came around and I joined Brain Bites, and it felt like coming home, like, these are my people. I love my neuro nerds. And that has just been such an amazing community of brilliant and passionate therapists that I just feel so fortunate to get to learn from, on a regular basis, like not only from you and Brittany and the other Re+active staff, but then just from the community at large. Like, we all have such different backgrounds and our own little niches within the neuro world that there's always somebody bringing something different that I haven't thought of before or ever approached in a particular way. And so it just feels like this amazing like pool of resources to pull from all the time. So that's been my experience getting to Brain Bites.
And I'm still kind of like, wow, have we only like been this much in contact over the last like 7 months or so?
I know.
It's hard to believe. It's really hard to believe because that community is very strong. I mean, and when I hear you describe it, I'm like, oh, I guess I made this for myself because I'm so similar to you, in running a practice and working with an amazing team. And one of my favorite things is to like just throw out ideas and go, I don't know what I'm doing here. Like, can somebody help me? And sometimes as like I'm just like you, like I go to CSM or I go to these other things searching for that like thing of like, let's go a little deeper. And some of those talks really hit me, right? Like Janine Holmberg, that same year at CSM, right? Blew my mind with her 3PD talk. And now she's going to join our Brain Bites group to talk about it, which I'm just like giddy about.
Which is not intimidating at all for Jamie and me to follow up Rob Landell and then Janine Holmberg and like, hi, here we are.
It's you. Well, and that's what I was going to say. One of the things that I love is our community. And one of the, I can't even remember what month it was, but we were diving into some cases. And I remember you started in on the chat. Well, like, actually, what about this? And like, I hadn't thought about that. Nobody had really thought about it. And it was when we were talking about Meniere's. And so you're dropping knowledge bombs left and right. And I was like, I need to learn more from Katherine, like just bringing that little, nugget of expertise to the conversation was really eye-opening for everyone. And that's where, to me, it's like, yes, we're sharing maybe what we're learning and doing at Re+active, but it's become a lot more about that like community and what people, everybody, and it could be you and Jamie who've been, expert therapists and NCS for a long time and running a practice, or it could be somebody who's fresh out with like new ideas too.
Absolutely.
So I'm amazed at that.
Yes. And that's such a strength of Brain Bites is that it is, it's a lot of expert clinicians, but also people who are newer, which brings a lot of energy and ideas and approaches that we were not exposed to in school. And so it's like incredible, like, oh, like this is standard, you guys are learning this in PT school now. Like I had to find my way to it 10 years in. So that's a really amazing aspect of it as well, that there are newer but experienced PTs within their own settings and fields, and we are constantly just learning from one another, which I absolutely love.
Yeah. And I love that it's really like open to that, something that's been really important to me and I know we've kind of talked to each other about being recovering or on the way to recovery perfectionist. It's like sometimes you don't want to get it wrong. You don't want to say something because maybe that wasn't the right move to make in that case, or like, oh, I should know by now we're not training the VMO like I learned in PT school, or or something, like you're afraid to get it wrong. And one of the things I've really loved is the community that has come around in here has been very much like, hey, like we're all kind of we're swimming through complex cases. We're figuring stuff out together. It's very welcoming to making mistakes. And like, you know, like what I'm still being back to when you brought up in that vestibular case, it's like there were so many of us that we were like, we don't even know what that is, you know, and people weren't afraid to say that.
Right.
And that was
Yeah.
like so welcoming to me.
Absolutely. I think that's such a strength of Brain Bites, is that there is no silly question. There is no judgment in, okay, this treatment idea with a laser and Velcro and bells, and, you know, it sounds crazy, but everyone is like, oh, fantastic. I can't wait to use that. And great idea, Chelsea. Or it's just such a supportive, positive group that I'm not worried about, like, if I throw this out, am I going to be judged or sound ridiculous? And how incredible to have that as a learning environment, because who learns well if you're scared that you are going to be mocked or you say something absolutely, you know, ridiculous. It's not that at all. I mean, it's just such a welcoming, warm, positive environment that I think it really fosters learning and fosters, you know, chances are if we're asking a question, half a dozen other people are thinking the same thing and wondering, like, wait, what did they mean by that? Or tell me more about this concept that I don't know anything about at all. And that was the thing, like, as Jamie and I were, when vestibular dizzy content would kind of come up, that we sort of realized, like, we see things through a different lens. We have a different treatment approach. And not that there's, you know, and that's the amazing thing about PT, is there often isn't a right or wrong. There's just, you know, 15 different ways to arrive at the same result. But we tend to do things a little differently. And so we started to think, we've been thinking for a long time, we wanted to teach a course. And then, you know, we're working moms, we have our businesses, like, when the kids are in college, you know, we'll teach a course. And then through Brain Bites, we were seeing, like, well, this is a really amazing and effective way to do online education. And Julie does such a great job of making it fun that maybe we could do it that way. And when we would discuss, like, okay, how are we going to go about doing an online course? We kept going back to, like, Julie does such a great job of bringing people in and engaging people. Julie does such a great job of following, you know, the chat and making sure nobody's, like, thought is left behind. And then we just started to think, like, maybe we just need Julie. So we approached you in January with this idea, like, what about partnering to provide this course on dizziness and this deeper dive? And we were so grateful that you said yes. And it's just such an honor to be able to work with Re+active to kind of share some of these ideas. And what we think is exciting about our course is that it is that kind of next level dive into, why is a person dizzy? What's perpetuating that dizziness? And how do we distinguish between a dysfunction and a hypersensitivity and a dependency? How do we look at the sensory weighting, and is that being used appropriately? How do we facilitate that? And one of the things we keep discussing is that without knowing it, like back in the day, we were addressing the autonomic nervous system. We just didn't have all the language for it that we have now. And we were seeing this intersection of dizziness with, you know, that increased respiration rate, heart rate, blood pressure. You see somebody start to tremble, like you can almost see the adrenaline eking out of their ears, right? This huge sympathetic response to being dizzy. And we were developing treatment strategies to help calm that sympathetic nervous system, not as like a whole separate approach, but to be used during habituation. So we're working to uncouple that response and really effectively, like, giving patients an off switch. So, you know, we all know the on switch, we get habituation, but how do we calm it back down? And to thinking about optimal theory, giving them a sense of control and autonomy in a situation where most people feel very out of control is really powerful and can really help just de-escalate, right? That ramped up response. What is so fun about teaching is diving into the literature, right? It just forces you to go back and go, what have I missed since I thought about this last? What's happened in the last year? And it's been so fun to look at, like, the functional components to dizziness that we now have the technology to really see, which is incredible. And to be able to explain that to patients, like, yes, your testing comes out normal. However, who's talking to who when, probably not normal. And I think
Mhm.
it gives such a sense of relief to patients when they've been told, you're normal, everything''s fine. Like, but they know they don't feel normal, right? And
Mhm.
so that's been super fun to find that literature and those references. And then really to also dive into the autonomic overlap with dizziness.
Mhm.
Um, and that's out there now, right? There's good resources there that weren't there like 10, 15 years ago.
No, no.
And one thing that like was completely mind-blowing for me this week. So I think about the autonomic nervous system and vision, right? And your pupil constriction or dilation and that acuity. I
Mhm.
had no idea that the ANS also regulates the aqueous humor volume. I didn't know that was a thing. So I've had for years patients who are like, I just have this eye pressure. And I've always thought like, okay, well, that's some variant of a headache symptom, or
Mm.
they're so visually dependent that they're getting this eye strain and they're perceiving that as pressure. And no, actually they have different volume of aqueous humor. And so they probably are experiencing pressure. And it
Mm.
just like underlines the importance of addressing the autonomic nervous system with dizziness. And it was another moment of like, oh my gosh, Jamie, you've got to check this out. Like, did you know this was even a thing? And like, so that's what's super fun about this whole process is just knowing that there are other people who are going to get super excited about that topic, because there's plenty of other people who are like, okay, crazy neuro lady,
Yeah.
whatever.
Well, I mean, and that's exactly why when you and Jamie, I mean, first we've had all these interactions within Brain Bites, and I've just loved it. And then you came with this, like, love thinking about this a little differently. And as soon as you say different, I'm like, I'm in, because I think our world is filled with like, well, first you do this and then this. And here's like X, Y, and Z to this problem. And you and I, and we all do come across things that don't fit in a box. They don't fit in your traditional way. And I mean, I kind of like grew up on traditional neuro. I worked in a stroke clinical research trial for years, which to me was like, stroke is like, that's like such a core part of neuro. And then to be in this realm of the unusual, weird curiosities of the nervous system. Dizziness is one and autonomic is another. And by the way, like I got, because we're doing our autonomic webinar this weekend, I have this article on the autonomic nervous system control of the eye. So I would have never known about the aqueous humor part except for that deep dive I've had into the eye.
It's the same
So
article.
same article. Okay.
It has to be.
It has to be the same. That is so funny because I feel like that was a deep rabbit hole I went down, and it
Oh,
just like warms my soul that you went down that rabbit hole as
yes,
well.
yes. We're all about the rabbit holes.
We're all about the rabbit holes. And so I think what's awesome though is that there are deep rabbit holes, and you and Jamie have been going down one for many years, and now you can synthesize and make that easy for the rest of us, maybe that haven't gone down that rabbit hole, to apply and figure out. And especially to those cases, and I think dizziness is such a big one where it's just like, nothing's working here. Like, I'm out of ideas. It's like, this is the cases that people are bringing to Brain Bites going, a little help, please.
Now what?
Like, I don't know what's
Yes.
going on. What can I do? This is really stuck. I'm stuck. So and the other thing I really have to say that Brittany and I were so excited about is we've seen Brain Bites as this kind of like brain, like a network of
Yes.
connections, and this idea that we're not all just like neurons like learning and growing. We're all kind of part of this like interconnected
Yeah.
brain thing. And I really see yours and Jamie's like 1 day course as like a manifestation of that network. Like, you're part of this network, and now you're taking what you've like grown to know and love and dive deep to share to everybody else. And I think that's so cool. And I can definitely see that growing in our community is that people are really interested in continuing to like present at CSM or
Yes.
put together a case study and just kind of like go beyond just kind of a
Yes.
passive learning experience.
Which I love. I love that there's all these opportunities to work together on helping to like publish a case report or presenting together with people that we never would have known of each other. Like that's an option now at CSM to do something like that. And so that's so exciting. And it's exciting to see other people get excited about those opportunities too. Like I just think, Jamie and I are the beginning of the like adjunct education, and that there's so many other great therapists who have their piece of the pie in the neuro world to share, their brilliance and their background, that I just can't wait for that to continue to grow.
Me too. Me too. I'm so super excited. So I want to share one more thing. I know we've been chatting for a while here, but something that has really, really impacted me, which also was like a side effect of the community piece, is there was one night within Brain Bites that I was like really frank, and I was like, look, like I'm not afraid to share. I go to therapy. In fact, I have therapy tonight after this. And I live with a lot of anxiety, and this is something that I'm like really working through. And after that session, you reached out and just said, thanks for sharing that. And I'm going to try not to be emotional, but
Oh,
that meant so much to me because it's not easy to share some of those things
no.
amongst professionals that you're working with and collaborating. But I also, because it's been such a part of my journey and it's such a part of our patients' journey, that I have become much more vocal
Yes.
about
Yeah.
it. And that little side conversation, and there's been a lot of like just little side support and conversations through, because we use Slack as an online
Yes.
community, um, that I just wanted to thank you for
Oh,
that and like really share with the world what I think. I mean, one, that I just think you're an amazing like person, but you're also a person um to like really kind of reach out and support and care for others. And that's like, we didn't create Brain Bites to be a support group, but I feel like there's that added benefit of like not
there
alone
is. Yes.
as a mom, as a business owner, as a neuro PT, struggling with patients that are maybe overwhelmed, and I'm
Yes.
overwhelmed, and all of those things. And so that is something that has like truly meant a lot.
Well, likewise, Julia, I appreciate your openness and honesty. And I think we grew up with the emerging like normalization of depression, anxiety, but our parents' generation definitely did not, right? And so it's something that I'm so comfortable with. Like everybody should be very, very feel very positive about their sharing of their struggles and experiences. But then when it comes to yourself, it's hard to be like, well, everyone else can go ahead and talk about their mental health struggles. But really, I mean, I've had very huge bouts of like depression, and for years I've thought like, okay, but I don't have anxiety. And then it's been in the last few years I'm like, no, when I think I'm really stressed, that's anxiety. When I like can't shut off the worrying. And I think part of what makes for a really good therapist is that ability to connect and really care about patients. And what's hard in our setting is that we have people with really hard diagnoses, and we may not see people make leaps and bounds of improvement. We might just be staving off the progression of something really rough, and to not take that on is hard, right? And we spend
Mm-hmm.
all day just giving so much of ourselves, and you come home and there's little people. Some of my little people are bigger than me now, but people, and then there's more of that, and there's at the end of the day I feel like I've got nothing left in the tank.
Mm-hmm.
And that it's so important to have our own mental health and physical health in mind, because we can't be effective, we can't be good PTs if we have just sucked ourselves dry. And so I think that one night in Brain Bites, it did become like the support group, but we were all like, oh my gosh, I needed that so much. It's just so good to hear other people say, I love this, but it's hard sometimes.
Mm-hmm.
And that's what I want for newer therapists to understand. Like, it's okay. There's going to be times when you really are just burnt out, but don't feel alone or don't feel ashamed about that, because this is a wonderful but hard profession when you do it well, I think. And I don't want to be somebody who coasts, but there are times when it is just really exhausting to keep giving of yourself. And so to acknowledge, like, there are times when we need to take care of ourselves too. And by no means do I have this all figured out as a balance therapist. I do not have the whole balance in life. There are some things I have to just be okay with, like haven't cleaned the tub in a month. It is what it is. That's just how it's going to be. And that's okay. That I've had to let go of the idea that there is such a thing as perfect. And I'm trying even to not use it with patients so much, like perfect, because we can't, there isn't, right? But it can be like great effort or awesome, or that was so much better and fantastic. But I'm trying not to use, and I use it a lot with my kids too, and just trying to stop saying perfect, because it wrecked me for a lot of years trying to, like, I've got to be the perfect mom and the perfect PT and the perfect business owner and you can't do it. So that's my ongoing struggle with being okay with, the effort is there, and that is good enough a lot of times.
Yeah. Thank you so much for sharing that. And again, I think it's such a good example of what you have brought to the community. I mean, I think because we care about this kind of psychological aspect of our patients, and that's kind of part of the deep dives that we do. I think that brings in us like an intrinsic, like, let's care about that for ourselves too, and our well-being overall. So I'm, again, don't think I could have even planned for that to be a thing. So I'm just so thankful that these things have just really occurred very organically within a community of therapists from across the world, in a neat and authentic way. So
but you've really fostered that, Julie. You've created this environment of that everything's okay, and we're here to support and grow and learn from each other. So you really created that, whether you intended to or not. That this is a product of the community that you've built. So I just feel so grateful to be a part of it, and for all the opportunities and the learning that it's just given me so much in a year that's been really tough. So I am like constantly, actually at Thanksgiving, we had this whole like grateful tree, and we had little like leaves to write things on. And I wrote like Brain Bites. I'm so grateful for Brain Bites. But really, it's been such a positive, amazing community, and all these opportunities to keep learning and for growth. So I'm just so grateful for you. For all that you've done to create this. And I think anybody who has the opportunity to join, or who's even slightly on the fence of like, just do it. Like, you are not going to find anything like this anywhere else. It is absolutely worth every penny, and you will walk away every time with like some great nugget to just use right away. And what you get in terms of like this support from all these other brilliant therapists is incredible. There's just no price tag that you can put on that.
I think we'll end on that. Katherine, thank you so much. I'm really excited for what's to come, and for yours and Jamie's course coming up in August. By the way, it's going to be phenomenal. And I'm going to see you tomorrow night in Brain Bites. So that'll be great. We'll have a good evening, and we'll catch you tomorrow.
Sounds good. Thank you, Julie.
Bye.
Bye.